I love technology. The specialty I work in, eye surgery, is full of gadgets and technology. We have a real opportunity with the work we're doing to actually use an electronic device to the benefit of patients. It's my role as a surgeon to act as the interface between the engineers who make the electronics and the patients who have the disease. Through our work, which is funded by the Department of Health, through the Biomedical Research Centre, we are effectively funded by the taxpayer. And it's very important that we're accountable and we feed back the work that we're doing with those funds which we've been given. Also, in the hospital, we're treating patients. And again, we need to let those patients know what we're doing to treat the diseases which we can't treat today, but hopefully we can treat tomorrow. That makes it much better for them in terms of dealing with the disease.
I think medical innovation is something fascinating, mainly because we are sort of trying to improve people's health and at the same time reduce costs to the NHS. For example, in my specific case, we're working on a technology to detect early stage cancer. So at the moment there is a limit on the size and the type of cancer that can be detected. And with the work that we are doing, we aim to improve the detection of certain types of cancer.
I'm really passionate about the research that we're doing because it's the first time that we're able to show people how their lungs work with imaging. And that's really important in terms of both understanding disease, but also for planning of treatments. And ultimately, I think the aim for our research would be to help personalised treatment for patients. So days like today are really important, firstly to disseminate knowledge. So one of the key aspects of being a researcher is to try and share the new things that we learn with everybody else. From a kind of professional point of view, it's also really nice to see what other work is going on in Oxford and also identify areas that we might collaborate and use an idea from another group to help our own research.
In general, I'm interested in medical innovation and research from just an advancing technology point of view, but on a personal level, it allows me to monitor my own condition a lot easier. The reason I decided to take part in the trials is because the existing tools for diagnosis and getting a picture of what state my lungs are in aren't that great. So the ability to actually take a look at emerging technologies and get a better picture of the way that my condition is evolving, I guess, was of real interest to me.
I'm very passionate about sleep, and I'm normally very curious about mechanisms and how things work. We are very interested in applying the basic science we find out about the sleep, how it works, and the body clock to apply it to medical diseases. And so I think the benefit is really then to provide information to the clinicians. Say, the eye is not only about vision and what you see and how to recognize things, it actually has a wider function of how you sleep and how the brain is processing light information in different areas of the brain.
The Surgical Intervention Trials Unit where I work is developing a research user group where we'd like to invite patients to have the research that we're going to be doing run by them so we can get their input. A lot of researchers are so engaged with their researchers that they don't see the kind of common sense aspects. So we'd like patients to give their views on the type of work that we'll be doing. You know, whether they're saying, I don't think that would like to come back for 6 extra visits or something like that. They can provide really important views which just aren't considered by researchers.
Medical innovation is important because it can transform healthcare, particularly in pregnancy. It can help us catch complications early before they become complications. We're also hoping to develop a remote monitoring system so that women can also be monitored from home using our Android application.
We're very dependent on people knowing about what we're doing so that we can get the appropriate referrals, people can come forward and be included in the trials. So communication is also very, very important. And the more people that know about what we're doing, the more rewarding it is for us and also for members of my team knowing that they're working on something positive. We're in the business of curing blindness, and that can take many forms: biological treatments, stem cells, gene therapy, or the electronic retinal implant. There are different ways of doing that. We don't really care which approach we use, we just want to pick the best approach that's best for the patient and most likely to yield results. There's a lot of work to do, but we already have lots of new technologies coming in, and many of the diseases that cause blindness that are currently untreatable will, I'm absolutely sure, be treatable over the next decade or so.